Interdisciplinary care. The hospice nurse should incorporate interdisciplinary care in various ways. The nurse should work with the team of healthcare professionals to ensure provisions of comprehensive care to Mrs. Smith. The team may need to be made up of the nurse, a physician, a chaplain, and a social worker. And these are just some examples. There could be other healthcare professionals involved in the care of the patient. For example, a nutritionist can be involved in the care of the patient or any other specialties that might be needed. The team should also collaborate to assess the patient's physical, emotional, and spiritual needs. It's important to assess and take care of the patient as a whole, not just the physical part of the illness, but the patient as a whole, including the emotional part and the spiritual needs. This will help them develop a care plan that addresses the patient needs as a whole, as I mentioned before. And it is important to work with Mrs. Smith's family to keep them informed about the patient's condition and ensure that they're involved in her care. And this part, it's really important because when we're taking care of a patient, as nurses, we just don't take care of the patient as one person, but also the family as a whole. Everyone is affected when a loved one is sick or going through healthcare issues. So it is important to keep the family updated and keep them involved in the patient's care. Efforts should be made to educate Mrs. Smith and her family about her condition. The education should cover what the patient and family should expect as the disease progresses and how the symptoms can be managed. The interdisciplinary team should ensure that the patient and her family have the support that they need, including spiritual care and counseling. And this will help them cope with the emotional and psychological aspects of the patient's illness. Some additional assessments that can also be included is that the nurse needs to assess the patient's physical, emotional, spiritual, and social needs. And this relates to what I was saying before, to treat the patient and the patient's family as a whole, not just the physical part of the illness or the side effects, the physical side effects of it, but everything as a whole, because everything is affected, not just the body or the physical part, but also the mind and the spiritual needs and the social needs. That unfortunately, that's a big part of it because many of our patients, while they're going through treatments and where they're going through the entire process, they worry about their family, about their financial situation. They worry about this might affect their children, their spouses. So the social needs and the involvement of a social worker and trying to offer the patient all the resources that they might have access to. It's really important also. And additionally, the family's coping and understanding of the situation should also be assessed. A nutritional assessment should be conducted to determine the patient's nutritional status and establish whether or not there are any nutritional deficiencies that need to be addressed. There is a need to conduct a psychological assessment to evaluate the patient's mental health, and the assessment will help them identify whether or not there are any underlying mental health conditions behind the patient's lack of appetite and anxiety. It's not uncommon for patients that are going through treatment or any process of illness to feel sad, to feel worried, even experience depression, and this might cause them not wanting to eat or not wanting to follow treatment, or so it is important to address this. It is important to offer them the help they need, and it is important to bring in a team of experts that are best equipped to help the patient.
As discussed in the case study, Ms. Smith mentions that she has been comfortable. She also states that she enjoys eating her snacks and continues to be comfortable. The nurse should continue to assess for pain in order to determine if the lack of appetite is pain related, which can be done through a thorough pain assessment, or if it's related to the end of life and disease processes. Some interventions could include providing the family education on the end of life process. Commonly, patients lose appetite and eventually can stop eating altogether, which is common in the end of life. Ms. Smith finds comfort in small snacks. If she wanted to ease her family's concerns, she could consider replacing her small snacks with snacks that are higher in protein and higher in calories. Ms. Smith should be encouraged to eat what she finds comforting in this stage. The family should also be provided support and education to continue to support her. Even though it may not be the most nutritional, it's what she finds comforting. The patient should also be provided medications to make her more comfortable. For example, pain, anxiety, and depression. These medications can help her manage her anxiety when dealing with the family and expressing her concerns. Medication can also help with the depression to make her more comfortable so she's not as worried about the family and how it'll affect them. And then should any pain happen, she has pain medication available to help her comfortable in other ways. Other interventions would be providing emotional and spiritual support. In order to provide this kind of care, the nurse would need to understand the particular emotional support that this patient would need and what kind of spiritual support she would need as well. In understanding these factors, the nurse can help her cope with the emotional and physical aspects of her illness. Application of nursing theory. The holistic nursing theory can be utilized in this scenario when it comes up with a holistic care plan for Mrs. Smith. The emphasis on this theory is encouraging that the whole person is treated and cared for. The recognition should be given to the fact that that an individual is not simply their disease, especially when it comes to end of life. The holistic approach that allows Ms. Smith to find comfort in her snacks without trying to cure the lack of nutrition. It also will provide opportunities to vent and help understand her anxiety, depression, and fears so that she may be at peace with herself. Ms. Smith mentions to the hospice care nurse that she wishes she had raised her children better and she wished that they would leave her alone. By providing these opportunities, the nurse can better understand why she feels this way and comfort her so that she may be at ease in her end-of-life process.
Based on this theory, holistic nursing needs to address the interconnectedness of the mind, body, spirit, environment, all these things as a whole. So these aspects, they work in combination to create the person. So healing is only possible if the nurse looks at all these aspects and their impact on the patient's health. So in this physical care plan, Ms. Smith, she should be provided with small amounts of food more frequently to help increase her caloric intake. The patient should be encouraged to eat foods with high protein, such as meats, like, and not just like red meat, but like salmon, like fish, and her calorie levels to help meet her nutritional needs. She needs to be provided with nutritional supplements to help her increase her protein and caloric intake. Ms. Smith's pain level should be monitored and pain medication should be provided when needed, not just like every hour even or like every 2 hours. No, it should be as needed. The patient's vital signs, including her respiratory rate, her heart rate, and blood pressure, should be monitored to ensure her stability because a lot of these medications can tank you. So it's really important to monitor those vital signs. The patient should be provided with emotional support as a way to cope with her emotional and psychological aspects of her illness. The patient should be provided with counseling to help manage her depression and anxiety. The patient should be encouraged to engage in activities that she enjoys the most. That will help her improve her moods. A lot of these patients are in the hospital for such a long time. I feel like they need that engagement to even help them get better.
Spiritual care is a pivotal part of holistic care. Sometimes spiritual care can be overshadowed by the patient's prognosis and diagnosis. For Mrs. Smith, the the spiritual care is can be a crucial component because of the anxiety and the stress she's feeling about how her family is reacting to her prognosis and diagnosis. Ms. Smith should be asked about her customs and her beliefs, and they should be respected. In our brief, we saw that Miss Smith's family is very important to her, what they think and how they're feeling, and how they're coping with her illness as well. First, the brief does not say that she gave consent, or that it's okay, according to Miss Smith, that the healthcare team speaks to her family. So we should get that understanding and get the consent that the family can be involved, after which the family can be involved in to whatever extent Mrs. Smith says that it's okay, until she's unable to make those decisions for herself. Family care has many facets when it comes to holistic care and patient care. Family care is a huge role in patient care and patient planning as well. Neglecting family care can exacerbate the patient's condition and, just make everything overall worse because the patient is more so concerned about the family than their own health. It's crucial to include them because, sometimes even, in my own practice, we, see that, it's helpful when the patient sees that the healthcare team is caring for the family as well, even if it's just getting some water or a blanket, or even suggesting, hey, did you go home? Did you eat? How about you go take a walk? Or did you, do you have, family or kids you need to care for, or things of that nature, or just suggesting that they even go home. If it's in a hospital setting, go home and have self-care, take a shower, just to get out the environment because it's overwhelming for the family as well. So, again, family care is part of the holistic care. The nursing care plan, from my point of view, is like a guide or a roadmap. It's not the final destination in planning care for your patient. The patient care plan should adjust and go accordingly to what the patient needs. It could be hourly, it could be 30 minutes, it could be daily, but it all depends on what the patient's current situation is. Like say for instance, what a patient needed on Tuesday, the patient may not need on a Friday. So it's important that care plan evolves as the patient does. Also, working with your interdisciplinary team is highly important as well, because me personally, how often have I heard, from my patients or the families, the neural team came in this morning and they said this, and the cardio team came in this afternoon and said that, and now you're saying this, so I don't know what to do. We're confused, we don't know what's going on. We feel like we're out of the loop, and you're not, that the team isn't talking to one another. So, to alleviate that, it's best that we all work together, each part of the patient's care team, so we know what's going on, and so the patient and the family don't have that concern on top of health. As nursing students, how many times do we hear about these care plans? And then also patient and family education. If I personally had $100 for each time we had to hear about that, I, would be much wealthier. Wouldn't have all the money, but I'll be wealthier. However, educating your patient and their families is a key part on how everything is going to go for the patient. In Mrs. Smith's case, it could change her last couple of days from a poor quality of life to a high, where, her last days are filled, with peace and calm versus chaos and confusion. So, educating the families on what's best and what, if medication is given, comfort and things of that nature. I mean, as an ICU nurse, I've heard many times, at least once per 312s, oh, I didn't know that we were supposed to float the hills, or my dad didn't take this blood pressure medication because he thought it was for something else, or he thought he didn't need it and no one told him. So patient education is key. In Mrs. Smith's case, it's important, and just overall our patients' health and how the outcomes will go for them.